Thanks again. And just looking at your latest findings on seafarers' health at sea and their access to healthcare, one of the first things that jumps out is you say they're remarkably upbeat about their own health, and yet at the same time you say like cargo seafarers, for example, are still not getting enough sleep. Is that something that's getting worse, or how do you see that?
It certainly, in the data, it certainly shows that it's getting worse. Um, so more seafarers in the cargo sector in 2024 said that they hadn't had enough sleep in the last 48 hours than in 2016 and 2011, and in very similar sorts of numbers in the sample. So I think the data is fairly reliable on that.
And what do
Um,
you put that down to? What would be the reasons?
I think there are a lot of reasons. The seafarers talked about. We asked them why weren't they getting enough sleep. So it's not me speculating. It's from the seafarers. Working hours, work shifts, um, concern about anxiety about work. That's particularly an issue in ports. And a lot of our data would be collected at the ports because we had face-to-face interviews with seafarers in the ports. Researchers actually completed the questionnaires with them. So it would often be the case that the last 48 hours included a port call. So there were long working hours in ports and a lot of anxiety for senior officers in ports because a lot of things can go wrong, as you know,
Yes.
inspections and audits and cargo operations and generally lots of interactions with the shore side, which also happen at all sorts of times, regardless, day or night. So it's also the case that seafarers are often some seafarers are put onto 6 and 6 watches on when they're in port. So their duties are changed, the duty hours are changed to become 6 and 6, 6 on, 6 off, which is very fatiguing. So yes, there are lots of reasons I think to keep that sort of have accumulated to mean that seafarers are getting less sleep than they used to, and our data also showed that their fatigue scores, which are calculated in a different way, um, are up as well. So on 2011 certainly, and on some measures and from they're up on 2016 too. So fatigue scores are also worse, which suggests ongoing issue.
What
Confirms it really. So there's two ways of looking at it, and both methods, if you like, we achieve the same result, if you call it an achievement, to identify that there's fatigue and
right?
loss of sleep.
Well,
Um,
somebody has to achieve it. And what's your finding with the your findings with cruise seafarers, cruise ships?
well, it surprised me that in the cruise sector, problems even worse. So, but in the cruise sector, it isn't the marine staff, the equivalent of what we have in the cargo sector. It isn't the engineers and the watchkeeping officers who have the biggest problem. It is the hotel catering, entertainment staff who
And
are
what
working long hours and split shifts, and they have the additional problem that they share cabins. So one of the problems that didn't really arise with cargo seafarers was being disturbed when you're trying to sleep by roommates, but that was a big issue for cruise seafarers. Often they'll be sharing cabins with people who are on different shifts, but there's also no privacy. Obviously, people make noises. That might be when they're asleep, or it might be because they're trying to contact their family. So there's all sort might be people coming to visit your crewmate. We heard stories about that, about how problematic it can be when you want to sleep, but some of your roommates want to socialize with other people. So all sorts of tensions and conflicts can arise, and loss of sleep is a fairly inevitable consequence of that.
uh,
Cruise seafarers also worry about guest rankings of their performance. So they do have work-related anxiety as well, but it's for different reasons. So, for them, it's very much related to passenger expectations and guest rating systems.
Well, I suppose passengers on the holiday of a lifetime, that kind of expectation. So what sort
Absolutely.
of recommendations would you have for combating fatigue?
Well, in the cargo sector, I mean, I've been at Cirque for 25 years. And when I first joined Cirque, there were fatigue studies going on. In the cargo sector, I feel it's a problem that is very overdue. It's a concern which hasn't been addressed properly, and looking at it properly is very overdue. There have been lots of efforts to sort of tinker around the edges, to introduce more oversight of work rest hours, ostensibly by making seafarers record their work rest hours, by bringing it into MLC and including it in inspections, making sure those documents are inspected. That's been one attempt that's been made to reduce fatigue. But of course, it doesn't. If there aren't enough people on board the ship to do the work in a way that allows people to rest properly, then all that happens, as several studies have shown, is that seafarers are more or less forced to falsify their records. I understand there's even some software available which is sold to shipping companies, whereby seafarers can't actually enter data, certainly can't enter it unknowingly. That means that they're in breach of the regulations. So it encourages them to adjust, let's say, their sleep hours and rest hours to actually fit with the regulatory minimums. But that doesn't stop them being tired, obviously. It's the same with fatigue management on board. Of course, it's good for senior officers to be aware of fatigue as an issue and to try to mitigate it where they can. But at the end of the day, if you are all working very hard in port, and perhaps you have 3 port calls, I'm thinking of the Sultan, the NCL Sultan that went aground in Norway. They had 3 port calls in the last 24 hours, as far as I understand. If that's the case, who is it who, how do you manage fatigue? If you come to me as the second officer and I'm the captain and you say, I'm really exhausted and I don't know that I can safely stand my watch, what would I say to you? Well, I'm really exhausted too. And either, if you can't stand the heat, get out of the kitchen kind of thing, because nobody actually does know when they're going to fail as a human being, if you like, and be a human being and fall asleep when they're exhausted. So you don't actually know at the beginning of that shift that this is the day when you're just not going to be able to, keep awake. So you can't, every time you're tired, when everybody's tired on board, you can't do anything like that. You can't actually go and ask for somebody else to stand in for you, because you'd be doing that all the time. It's impossible, and you're just actually meaning that, making it impossible for them to maintain their rest hours.
And
So
yet we see that the shipping companies are making record profits, so it wouldn't be a huge dent in their profits to add extra crew members. Would that be the way ahead, do you think?
I think it's definitely the way ahead, although I would tackle it in a slightly different way. I mean, that has been one of the things that people have sort of argued for, is that they've argued against the minimum crewing requirements, being so lax, and they've hoped that flag states would actually take a different approach and insist on more crew on board ships. I don't think that's likely to happen. I think what needs to happen is, if you look at the work rest hours regulations in MLC, which are being enforced by Port State Control, they're simply not adequate. I mean, it's perfectly possible within the regulations that in a 24-hour period, seafarer can have one rest period of 6 hours and one rest period of 4 hours, and that would be within the regulations. So long as over a 7-day period, they get another, on average, hour of rest a day. That's within the regulations. So that could be, that could be that they're given 4 hours extra rest on a Sunday or something like that, and that would compensate. Well, if you actually think about it, medically, the sleep experts tell us that we all need between 7 and 9 hours sleep, unbroken sleep, a night to, fully function and be on top form. And if you're getting a 6 hour rest period, that's just a rest period in between your working hours. So you still have to eat, you still have to wash, you still have to go from wherever you're, maybe from the bridge to your cabin and to the mess room to eat, wash, and get into bed and then try to go to sleep. So you're never going to manage to have that anything close to that recommended 7 to 9 hours. And so the rest hours are inadequate, and nobody's really facing up to that. We're accepting the rest hours because I don't really know why we're accepting the rest hours, to be honest, but they are being accepted as if they can't be changed. We're maintaining old-fashioned shift systems as if they can't be changed as well. And it's not working because we're having more and more fatigued seafarers. We're still having fatigue-related accidents where people die and there's pollution. And it hasn't been working for the last 25 years because in all that time, there has been concern about fatigue. There have been these various different approaches tried. I think it's time that we accepted that these approaches don't work. You need to change the regulatory minimum rest hours. You need to increase the amount of rest that seafarers are entitled to, align it with shore-based work, where after all, we all go, to our own beds in a stable environment that's quite quiet and peaceful. If we need 11 hours in the UK rest in between work shifts, then, how much do seafarers need when they're living and working in an environment that moves, where they might be feeling seasick, where there's noise? If anything, it would make sense, it would be rational for the rest hours to be greater for seafarers, not less. But at the
Yeah,
moment, they're significantly less because,
yeah,
sure, we're also in the UK entitled to a 24-hour rest period every week, which seafarers also don't have. And that's one of the things they talked to us about at interview, was the way in which, yes, you can be sleep deprived for a period of time, an intense period of time, but when you keep going week in, week out, week in, week out without enough sleep, that cumulative kind of exhaustion sets in, and that's when you really are up against it in relation to fatigue.
yeah. Another area you talk about quite a lot in your report is access to healthcare and how cargo seafarers have less access to medical professionals than cruise seafarers do, but even they don't quite get what they need when it's needed. And you've come up with some real horror stories of people getting appendicitis at sea and then being sent to have a lay down and being in intense pain for days. Could you take us through a little bit what you found and what your recommendations are there?
It's very sad, really. The regulations mean that current regulations mean that if there are more than 100 people on board a ship, that there needs to be a doctor, but there's no requirement for that. At levels underneath, below that. So, lots of ocean-going cargo ships might have 20, between 20 and 25, perhaps, crew on board. So they're not going to reach that threshold, and they don't have medically trained personnel on board. Now, in the past, a long time in the past, there used to be some fleets that would carry doctors, and I know I've heard and first-hand accounts of people who were helped. So you didn't have a doctor on board your ship, but you would call up, and perhaps if there was a Russian ship, for example, in the vicinity, they might be carrying a doctor, or they would be carrying a doctor, and you would be able to get assistance. And seafarers would actually get transferred between ships for that medical assistance. But there's nothing like that anymore, and it's all ships are very similar in that they're not carrying medically qualified personnel. Of course, there is provision for them to have a medical chest, and there's an officer who's designated to be in charge of that and might give out, minor medications. They do have a little bit of first aid training they told us in the research that it's totally inadequate, if it comes to actually dealing with any real trauma, injuries and medical emergencies. They have no diagnostic skills, of course. They are supported by telemedical services, but these are hampered by the fact that you usually have to have a seafarer acting as an intermediary, either with email communication and then going face to face with the seafarer concerned, or perhaps with telephone call and then going off to talk to the seafarer and coming back to the telephone and so on. But there's invariably an intermediary. And of course, it means that not only is the doctor who's trying to give the advice not able to actually see the seafarer, not able to touch them or examine them in any way, but they also can't ask a question and then hear the answer and respond with more relevant questions as a result of the answer. What they're getting back is actually not a verbatim account from a seafarer. They're getting some intermediary's interpretation of what that seafarer said. So you can see in that process how plausible it is that misdiagnoses regularly occur, really.
And of course, you're working in multiple languages as well, quite often, I imagine. So that's
absolutely, it's an additional problem. And the seafarer is perhaps, they might be talking or reporting to a senior officer. So there are issues about hierarchy and nationality and language, and all these kinds of factors play in. Job insecurity, because most seafarers now work on temporary contracts. So there's that whole issue of not really wanting to make a fuss and not wanting to lose your job as a result of having made a fuss. And we did hear a lot of horror stories that we didn't really look for them, but they came. And so we heard of cases of seafarers who had been misdiagnosed, misunderstood. Their symptoms were misunderstood on board. There was one case where a seafarer was thought to have quite common gastrointestinal problems. He clearly had something much more serious, and when he didn't turn up for his watch, they found him dead in his cabin. And the seafarers on board were really traumatized and shocked because they'd all thought that he had something minor wrong with him. And of course, he'd been working up to the last minute. And he appeared to have died in some pain, according to the testimony of the seafarer who had been on board that ship with him. So those sorts of things, not only awful for the person involved, obviously, in their family, but it's also awful for the crewmates who who encounter those situations and are part of the situation. We had a very helpful account from a captain who described how he had actually himself experienced appendicitis on board a ship, and one of his crew subsequently, a subsequent voyage, had similar symptoms. And he was pretty sure that this crew member had appendicitis from his own experience. And the telemedical service that they consulted didn't think that was the case. So the telemedical service was not advocating that the ship change course and seek immediate emergency medical assistance for the seafarer. But the captain, bless him, felt that it was necessary. And he described how he made the decision that they would change their voyage plan to go to the nearest port. And that's what they did. And, he said at the interview, of course, I didn't want the seafarer to have appendicitis. Of course, I didn't. But actually, once I'd done that, made that decision, I was praying that they did have that diagnosis, because otherwise he knew that he would be in a lot of trouble. I think he feared for his own job. Now, that actually shows how the system, in some ways, there are forces within the system that actually mitigate against good treatment for seafarers. So the telemedical service ideally is supporting seafarers and getting good diagnosis, but in this particular case, the fact that they, in the imperfect process, had arrived at the wrong diagnoses, made it actually more difficult for the captain to do the right thing. I think it would have been easier if he didn't have a medical professional saying something different. He could have just made that call and taken the seafarer report. And if he'd been wrong, nobody would have really blamed him. But going against the medical advisors was a really difficult thing for him. He also
So,
talked about an experience where he had two seafarers very badly injured on his ship, and it was days before they could get access to medical care. And what came across in all the stories that we heard really was the way in which the seafarers on board just really don't know. They can't really do any interventions, and so what happens is the seafarer is sort of confined to their cabin, and food is brought for them or whatever. And somebody might check on them every now and then, but there's no medical care as we would think of it.
so do you
So
think the shipping companies are on the side of the seafarers, or are they more on the side of making profits and the seafarers come a poor second?
I think the problem is that shipping companies only have control of a relatively small number of their operating costs. So they don't have a lot of control over bunkers, for example, bunkering costs. They don't have, a huge amount of control over a lot of costs. Stores, for example, where they take them on, if they really have to take them on in a certain port, that it's a little bit difficult for them to control costs there. The one set of costs that they can control is in relation to crewing, and I think that's why it gets a lot of attention. But I also think that there's a way in which um, people in shipping companies perhaps lose sight of what the consequences are of some of those decisions. Um, uh, I think when companies were family owned and knew their seafarers well, you did have a much higher level of care in many cases. Um, Seafarers are rather remote. Companies, the fleet managers and the superintendents and so forth, they don't necessarily know the seafarers on board terribly well, if at all. And so that makes it rather human, I suppose, on their side to not properly understand the consequences or not see the consequences of some of the decisions that are made. And I think the other thing is that there is a bit of a tendency to accept, oh, this is how it is now, so it shouldn't be changed. But I think, consumers would be shocked that their produce is arriving perhaps at the cost of that kind of basic medical care that we all take for granted ashore. I think people would be kind of, if you ask them, did they want to pay a little bit more on their bunch of bananas or whatever in the supermarket, or have seafarers dying in pain because it's seen as too expensive to provide medical care on board. I'm pretty sure the consumers, most of them, would go for a few pence on a bunch of bananas. And anyway, the costs can be defrayed in various ways. And if you have regulation requiring certain jobs to be filled on board, like insisting that you had medical personnel on board ocean-going vessels. I mean, I don't think it's necessary on short sea trade vessels, but on vessels that are engaged in longer voyages, it seems reasonable to carry medical
Is that a
personnel.
recommendation that you're making? Are you calling for that?
We are, and I think it's really really necessary, and I know that there'll be a lot of focus on the economics of it, but actually I think it's a relatively marginal cost. Shipping companies, as you said, are making some shipping companies are making large profits, and so you could shave a bit off the profit margin without it being the end of the world. But if that wasn't the case, and if that translated through to additional transport costs per unit on your bunch of bananas, for example, you're talking about very fractional increased costs. I think that wouldn't be a problem. I know that when they've cut crew members from crew complements in the time that I've been doing research at CERC, that we haven't seen drops in prices. We haven't seen deflation, and so I think it's pretty. Although although their focus is always on, oh, this would be a great cost. And if you look at something across a fleet, you know, even if you look at the price of a dustbin, for example, across a fleet, and you decide to, instead of thinking about the unit cost, you decide to sort of look at, well, what if I put this on 200 ships? It suddenly becomes a big number, and that has a power on us, I think, that it shouldn't have, because actually the cost of the unit is not very great, and we're not very good at thinking of really really big numbers. So when we see the profits, or when we see the other operating costs, they tend not to have the same sort of grip on our imagination, because
Mm,
beyond a certain level, you just can't really understand properly what a figure means, really.
yeah.
So
But
I think the focus is inappropriate on, in that way, and we should not talk about it in economic terms, but we should talk about it in terms of, well, what is actually acceptable ethically here? Should we allow seafarers to be going to sea without medical assistance? And I'm not even just talking about the emergency assistance. I'm talking about the day-to-day medical advice that you and I take for granted on cruise ships where there are doctors. The crews don't just consult in emergencies. I mean, they actually take advantage of advice that they can get on, more minor ailments like food allergies, or things like dermatitis cases that come up. Seafarers on board cargo ships don't get any kind of treatment for that at all, beyond access to, a very limited range of medications in a medical chest.
yeah, in your findings now, you tell some good news stories as well. And one of the things you were saying is a, a better diet and more access to fresh fruit and vegetable, or fruit and vegetable, but it's not always fresh, because on the cruise ships, it's what the fare-paying passengers haven't eaten. So, is that a good news story, or is that
I
how
think
do you?
the good news story is that in the cargo sector, seafarers, if you accept that low to moderate alcohol consumption, low consumption of fried food, and increased vegetable and fruit consumption is all part and parcel of healthy behaviours, then there is a good news story for cargo sector workers, because from 2011 to 2016 to now, alcohol consumption has fallen in terms of frequency and amount. Smoking has fallen. I didn't mention smoking previously, but obviously that'd be another one. Fried food consumption has fallen, and they're not very much in control of fruit and vegetables at sea. And there's a significant portion of seafarers and cargo ships who don't feel they have enough fruit and vegetables. So there's room for improvement there. But I think in terms of their own behaviours and their own health awareness, taking multivitamins and things like this, they are really on board to keep healthy, and they've changed some of their less healthy habits for more healthy habits. In the cruise sector, we can only just look at this snapshot of 2024 because we don't have prior data. But in the cruise sector, they have about the same sorts of rates of smoking. They actually eat more fried food. They're less happy with their food than the seafarers and cargo ships, which was a surprise to me. They do say that they get fruit and vegetables, but that it's often spoilt. It's overripe, because it's leftovers from the passengers, which was a bit of a shock to me. And I think it's kind of interesting on cruise vessels. I think what they miss, that cargo seafarers probably don't even appreciate that they have, is that they miss the relationship with a cook and with the cooking team, the catering staff. They are just one amongst many, 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 many crew on board a cruise vessel. And but on a cargo vessel, if there's 25 of you, and you have a nice chief cook who's open to this sort of thing, you can always ask for, would you mind doing beetroot soup or whatever it is that you would fancy. And they can accommodate you, but you're such a small cog in a very big wheel on a cruise ship that there's no opportunity to do that. So often seafarers on cruise ships, would be eating the favoured diet of a different nationality, and then that wouldn't go down terribly well, for
Hmm.
example.
And you
Um,
said as
yeah,
well
there
that
is a
the
good news story in terms of seafarers' own perception of their own health and their real desire to maintain their health. I think they see it as very important to maintain their job. So they're investing in their own personal health,
Yeah.
to invest in their own future, really.
And you said the amount of money allocated per day for food has actually gone down in recent years. What did you discover there?
That was the perception, and certainly when we asked about, well, what is the per diem rate, and in the cargo sector, people were talking about $6 to $8, and I know that 10 years ago there were companies who were provisioning at much higher rates than that. So that was a bit surprising. The cruise sector workers, the perception is, or what they reported to us was actually even lower, significantly lower, because in the cruise sector you can benefit from economies of scale. Um, so the per diem budget is lower, much lower.
Does that
And
surprise you?
It did surprise me. It wasn't. I mean, it makes sense now that I've been told it, but yeah, it wasn't something I was anticipating, so I just haven't really thought it through in that way. Um, I don't think it's enough, and the cargo sector workers reported that it's not enough to adequately provision in some parts of the world. A lot of them did report, and people who would definitely be in the know. So, what chief cooks, for example, captains, for example, reported the budgets being reduced. So at a time when we've got, pretty widespread food inflation, in terms of food price inflation, we've seen a reduction in the budgets, which is obviously not good. And seafarers, do talk, and this is something that I was already aware of, but it was interesting to hear so many accounts of seafarers talking about ships where provisions had run out, and that's an issue when perhaps you end up going to anchor for longer periods of time than expected, or um, the issues there that are probably resolvable, actually, probably quite easy to deal with, but don't get dealt with. So seafarers end up just being fed the same thing every day. Maybe we were told about one that congee was served every day because that was really all there was left was rice.
And what is congee?
Um, I didn't make it myself, but it's a rice-based sort of soupy sort of rice-based dish, I believe. I don't think I've even ever eaten it, but I
If
think
you
you
had
might.
to eat it every day, you'd get
I
tired, I'm
wouldn't.
sure.
There's nothing that I would want to eat every day. I don't know about you, but in that, certainly not 3 times a day.
No, no.
So
You mentioned elsewhere in your reports the problem of stress and well-being and the needing to relax at the end of a day. And you recommend the greater usage of bathtubs and saunas. How important would they be, do you think, to seafarers, and how likely are they to ever get them?
well, some seafarers have them already. So 10% of seafarers in the cargo sector had access to a bathtub, which I was surprised by. And about 15%, I think it is, had access to a sauna. And I've been on ships, doing research on ships where there have been saunas available, or a sauna available to seafarers on cargo ships. On cruise vessels, sometimes seafarers are able to, or cruise sector workers are able to access facilities that would be available for guests, like saunas, for example, and spa facilities sometimes on special occasions, perhaps. Or if they're senior managers, they might have more regular access. So there is a certain amount of availability on board already. So it's not completely off the wall, as it were. But if you think about the sort of work that seafarers are doing, often it's hard physical work. So often you're going to have muscular problems, aches and pains. Musculoskeletal disorders is one of the more common disorders found amongst seafarers as an occupation. And if you look at the advice of something like the Arthritis Society in the UK, you'll see that they advocate hot baths as a therapeutic remedy for aches and pains. And of course, on an everyday basis, we all know that can work
Yeah,
for us. And we also know that people use baths as a sort of mental relaxation as well. A hot bath can also relax you. Baths are sometimes incorporated into the therapeutic treatments are available at spas, for example. That's because of that relaxation sort of element that's there. So I think it's a relatively minor change to have more baths. Something that at first glance seems like a bit strange. Why would we recommend those? But actually, when you think about the therapeutic benefits, and when you ask seafarers whether they would want them, there's I think it's between 40 and 50% of seafarers without access to baths would like them on board. And saunas are even more popular than that. So saunas have similar benefits, and they also have even greater therapeutic benefits, according to the research that's been done in staving off things like Alzheimer's disease, for example. So there is a train of thought that saunas really are, very positive in relation to maintaining health.
Okay, great. Now, this is one of your last pieces of research at the Seafarers International Research Centre, because it's been closed down by Cardiff University as part of its cuts. How does that make you feel? You're the last member of staff standing, I believe.
It's a little bit more complicated than you suggest, but how I feel is I'm very pleased that we are able to keep our website going at Cardiff University. That means that the work that we've done and the resources and the things that we've made, the films, animations, and so on, the tools that we've made that we hope the industry make good use of, will still be available in one place, easy to find. And all our reports and work. And I know that the website has been a good resource for scholars and for people in the industry when they're looking for material on particular topics. We have things organized by topic if people want to try to access information in that way, which is quite unusual, I think, to do that. So it is a good resource. So I'm really glad we're able to keep that. I think we've made a good impact across 30 years on the area. I think it's not always possible to link an outcome with a piece of research. In fact, it's almost always impossible in an international global industry. But I feel we've made a positive contribution to the conversations that have gone on around seafarers' welfare. And most importantly, I really do feel that we've had the opportunity to allow seafarers' voices to be heard. That's really what our research has done.